we imported the same slides on Dr. Iman because ما بدنا نزيد عليكم workload, ما بدنا نزيد عليكم that just not feel overwhelmed. أول كم من slides we're gonna see them فيهم different classifications, فيهم different naming, أشياء زي هيك. Just understand them, don't get deep on them. أنا last year يمكن أقعد أول ساعتين بس على أول slide بدون ما أدخل أصلاً على البنسلين لسه. They are mainly just for you to understand إحنا عن شو عم نحكي. إحنا we're talking about what. Just understand them. وإحنا we put some slides for you يعني go through them thoroughly and don't waste your time عليهم. So yeah, okay. So now to start with the cell wall inhibitors.
Okay guys, so this part of the recording was cut, so I'm redoing it. Basically this was the first mnemonic. It will help visual learners, so give it a try. Basically this sums up all the cell wall inhibitors in one picture. Cell wall inhibitors always reminded me of a pencil on a paper, the paper representing the cell wall, while the pencil representing penicillin, which is the first antibiotic. So as I said, the paper is the cell wall and the penicillin is on it. The tip of the pencil or the head of it will remind you of cephalosporins, with the cephalo referring to head. The tip of the pencil also is shaped like a V, so representing vancomycin. Obviously you use the pencil to write alphabets such as A, B, C. So A stands for azole, B for bacitracin, and C for cycloserines. So this mnemonic will help you to wrap up all the cell wall inhibitors at once.
Lectures, okay? By the way, don't waste your time to write the notes or the mnemonics. We're gonna provide you with a PDF. Okay, so let's start with the actual cell wall inhibitors, starting with the beta-lactam ring and the non-beta-lactam ring, okay? So penicillin, cephalosporin, monobactam, carbapenem, كلهم what do they have in common? A beta-lactam ring, صح ولا لا? And the vancomycin, bacitracin, cycloserine, they lack this ring. بس كلياتهم they work as cell wall inhibitors. So how how you're gonna memorize that? I know it's silly. رأس قلم من كربون. The RAS is all going to remind you of the cephalosporin, قلم pencil, penicillin, monobactam, and carbapenem. هون بس مشان تعرفوا إن هدول كلياتهم they have in common a bactam ring, beta-lactam ring. And the sensiline اللي هن the endings. يعني you either memorize this or memorize this. طيب, starting with the mechanism.
Just to know how does the bacteria build its cell wall. Basically هلا احنا عندنا البنسلين بايندينج بروتين، هذول البيلدرز تاعون السيل وول. They just like بيمسكوا البريكس تاعون السيل wall, they hold the bricks and they build it until they build the cell wall. And this is the mechanism of penicillin. Penicillin will come here and they will stop the builders from building whatever they're building the cell wall. So they're called based on their function اللي هم penicillin binding protein. هلا they have another name اللي هو transpeptidase. And whenever you see the E's, it's representing what? Enzyme. So the penicillin will come here and block the enzyme from doing whatever it has. And the bacteria is going to look at it and say, okay, I have to stop this. What I'm going to do, I'm going to make beta-lactamase, and they're going to inhibit مين? Penicillin. Are you getting me ولا نعيد؟ نعيد؟ نعيد يلا. Okay, هلا احنا عندنا building blocks تاعون السيل وول، بريكس. هدول البريكس مين عم بيصنعهم؟ Who are building the cell wall? This guy, penicillin binding protein or transpeptidase. Transpeptidase, yeah, transpeptidase. بيمسكوا البريكس, they hold the content of the cell wall, they link them together. This is a normal function of the bacteria cell wall. طيب هلا احنا we want to inhibit the bacteria from building its cell wall. We want to cut the cell wall. بتيجي مين؟ بيجي البنسلينز اللي هم بيتا لاكتام. بيتا لاكتام بيجي بوقفوا عند هون. يقولوا stop, don't do whatever you're doing. I want you to stop building your cell wall so you can die. You don't have like a structure and that, so you can die. So this is how penicillins work. طيب تيجي البكتيريا is smart a little bit. It is like I'm gonna resist the penicillin. What I'm going to do? I'm gonna make my own warrior اللي هو beta lactamase. بيجوا beta lactamase. They're gonna cut the penicillin so the penicillin ما بيجوا بيلزقوا بالpenicillin binding protein. فبالتالي السيل بتضلها عم تبني بحالها. كلير هيك؟ Yes. طيب هلا let's have a question. You took this lecture with Dr. Hiba. Who do you think is stronger? Is it the gram negative or gram positive bacteria? Negative. Excellent. طب ليش؟ Excellent. So the gram negative هلا عندها زي كأنه two barriers. عندها هذا inner barrier وعندها another barrier اللي هو outer membrane. فبصير البنسلين it's harder to get in. فهلا بس تشوفوا الدراجز تاعونا بدكم تركزوا على هالشغله انه في drugs they have if they are strong they can kill the gram negative. If they are weak they cannot kill the gram negative. Okay, just they focus on the weak. مين weak bacteria عندنا؟ gram positive. Okay, getting it? Okay, so again, remember the beta-lactam family represented by the paper and the pen. Okay, so now let's look at again the characteristic of beta-lactam. Whenever you have in your mind this drug contain a beta-lactam, what you will think of? Give me just one example. Whoever studied the lecture. إذا عندنا beta-lactam شو رح يصير؟ يا غير ارجوك give me a characteristic. اذا كان عندنا بيتا لاكتام اول شيء حكينا الميكانيزم انه it's gonna inhibit the builder مين هو؟ transpeptidase صح؟ So this is the first thing. The second thing, it's also affected and it's susceptible to be killed by the beta lactamase. One more thing we have to focus on انه the penicillins they are weak بشكل عام. Why? Because they are affected by acid. But technology has developed صار penicillins they are stronger that they can like withstand the acid. But they're called acid labile. mean acid labile يعني إنه they are affected by the acid. Last thing is these penicillin when they are broken down in our body they can cause penicillin allergenicity. You have heard about it and Dr. Iman explained it for sure. So what happens in the penicillin allergenicity? Once these penicillin are broken down, they will come and stick to the red blood cell. Now in our body, once we have detector molecules, as you studied in the immunology, they will come and they will detect the red blood cell. Oh, is it a normal cell? Okay, we're leaving it. But it's having a very abnormal molecule sticking to it. What is this molecule? They will think, okay, wait, stop. Let's kill this. This is a very abnormal thing, we don't know it. So with this and this penicillin allergenicity, the blood will start attacking the red blood cell and it will cause hemolysis, breaking down of red blood cell. Now, when this happens, رح يصير عندنا release of histamine. And you know histamine, as you took قبل شوي, inflammation is going to cause vasodilators, which is reaching us to the anaphylactic shock. And you know what's the side effects, what's the symptoms of anaphylactic shock? Fever, rash. Then we're going to discuss it more about side effects. Okay, so but after we invented the penicillin, we got to know how this, what is their mechanism of action, and what is the characteristic of having a beta-lactam. We divided them into 3 groups. The first group is the natural penicillin. هذا أول drug, the first drug to be invented in the factory. It was very narrow, it was very limited, لساته بسيط. ثاني drug عندنا اللي هو anti-staphylococcal penicillin. It's staph sensitive. The last one, إجوا حكوا خلينا نوسع حالنا شوي. خلينا let's just get more advanced and go for an extended spectrum penicillin. From the name suggests extended spectrum, it's going to work into two spectrum, gram negative and gram positive. Now, كمان إجوا حكوا okay, since this is a very broad family, let's divide it. Let's have it based on their structure. There's aminopenicillin, carboxypenicillin, and uridopenicillin. And you can see amino group, carboxy group, and urido group.
Just to remind you with the transpeptidase mechanism, transpeptidase هو مسؤول إنه يشوف دي ألينين in the building group. صح ولا لا؟ It's gonna come to it, cleave one of the D-alanines, remove it, and take the pentaglycine and stick it to it. فمثل ما هو شايفين, this is the lysine, this is جنب الدي ألانين إجت لفوق, and the transpeptidase basically ligated this part, okay? معناها هاي النيو one. Again, this one has the D-alanine, it's gonna repeat itself. صح ولا لا؟ إذا أهم binding site عندي الدبل D-alanine. صح ولا لا؟ أكيد صح ولا لا 3 مرات.
mechanism of action رح يجوا على البيج جاي اللي is building the cell wall يحكي له stop building the cell wall اللي هي transpeptidase اسمه الجاي. One more thing عندهم انه they enhance Autolysin. You know what is an autolysin? Exactly. So the cell itself is gonna release sometimes an autolysin to kill itself. So once this is like in a very advanced stage, maybe there is a disease, maybe there is something. يعني خلاص we're done with the cell. But this is a very normal bacterial structure. بيجي البنسلين بيحكي له okay release more autolysin. The bacterial cell is gonna kill itself more and more. So this is another mechanism how it can kill itself. Okay, let's dig deep now. To start with, penicillin G. Penicillin G now, as we said, it's the first one, it's narrow, it's weak. Since it's the first one, narrow, weak, مين حكينا الweak bacteria? Gram positive. فإتس gonna kill مسؤوليتها الgram positive. The second thing, بما أنها لساتها weak, فإتس acid labile, it's affected by acid. And the way to remember this, you can say the weak, اللي هي penicillin G, the first drug invented. Weak attack weak. It's the weak drug attacking the weak bacteria, which is a gram positive. Weak is afraid from acid, so it's affected by acid. It's called acid labile. And then we go penicillin G, benzathine. You can see the same name, but they added one thing. It's the benzathine, right? So by saying the benzathine, this drug is just having the same action of the penicillin G, but it's prolonged for a longer half-life. And we can say that benzene, when you go for benzene, it fuels you for a longer time. So just remember it like this. When you see the exam, what's the difference between this and this? It's just a longer half-life. Then we come to the penicillin VK, try more advanced. The penicillin VK is just like, okay, I'll be a little bit stronger and I'm not going to be affected by the acids. So penicillin VK, special about it? No, it's not affected by acid. This is the only difference. So how can you memorize it? And Vicans, it's a shortcut VK for Vicans. هلا medically it's not, but you just imagine it. VK resists acids. You can see the picture. Yeah, let's go now to the other one.
Benzene, what's the relation?
Benzene? Okay.
Just the benzathine and it spells like
It's not مش هيك بس انتوا you just get to memorize it, you know?
The mnemonics mainly خيالية.
Yeah, بس no to catch it up بالامتحان.
هلا the second one we're exposed now لأول وحدة that is resistant to what the beta lactamase. What is another name for beta lactamase? Penicillinases. صح ولا لا? So this family is a bit stronger. Okay. So this one is the first family that is beta lactamases resistant from its name. There is a nice mnemonic for it. One cannot destroy me. We're referring to what? To the beta lactamases that does not actually impact it. So the O refers for the oxacillin, the C for the cloxacillin, the N for nafcillin, the D for dicloxacillin, and the M for methicillin. Methicillin طبعا is discontinued. Why? Exactly, interstitial nephritis. Okay, so what bacteria would it actually impact? The methicillin sensitive ولا methicillin resistant? Sensitive من اسمه أصلا. The methicillin resistant. The MRSA أصلا we're struggling with it, صح ولا لا? Lastly, we have what? The extended spectrum. Do you remember it? The one that's divided based on its structure. Here we have the triple A's, which is the aminopenicillin that has the ampicillin and amoxicillin. Amoxicillin is which drug? As a trade mark? Augmentin, exactly. So it's very famous, صح? The carboxycillin, its family is tigercillin. You can remember it as Cortrap, but we're going to refer to it as tiger in our mnemonics. And uridopenicillin is pipercillin. Here we're starting with the sketchy.
Okay, so guys, I want you to see this thing, understand. Sketchy might be beneficial for some topics, for some topics it's not beneficial. فيعني don't overwhelm yourself and okay, if I'm not focusing on this sketchy with this topic, okay, this is a big problem. هلا for the extended spectrum penicillin, it was a little bit good, like I enjoyed it. And you can see I noted on it, like you can do the same. So once you're in the final, you don't have to watch the video again. And the sketchy, it mentions a lot of things that's extra out of your PowerPoint, like extra. So you can just note what you have to focus with what Dr. Iman wants from you, not just to get yourself with extra information. And this, as you can see, you can note down what you have done. And this will be sent to you. You can see with each picture, what does it represent. It's written here. Okay, so now let's go for the extended spectrum penicillin. What's special about it? It's still extended, but however, it's affected by the beta-lactamase, which is the warriors of the bacteria. صح, it's extended, but don't mix it up. It's still affected by the beta-lactamase. Okay, let's start with the good work now. Ampicillin is my favorite drug. I think it's the favorite drug of Dr. Prof. Iman, because ampicillin is very clinically known to fight against Listeria monocytogen, it's a type of bacteria, and enterococcal species. Now keep repeating it من هون لبكره. Will you memorize it زي هيك with the other complete drugs that you have in the upcoming slides؟ يعني يمكن يكون شوي challenging. So we invented a small mnemonic. Okay. So مرضة منى مهسترة وضعيفة. Now اتفقنا ما حنحبها. So مرضة منى مهسترة وضعيفة. It's like, okay, what's related? How it's related? Let's just get to break it down. معدة, let's just start with the معدة. معدة is going to remind you with the GIT system, the anterior bowel movements, and this stuff. So معدة is going to remind you with the bacteria enterococcal. Okay? And منى مهسترة. You know مهسترة is going crazy? You know it in Arabic? I'm sorry for the non-Arabs, I'm really sorry. But okay, what does it mean مهسترة? Listeria monocytogen. And it's very common. You're gonna see it in other drugs. So just try to stick. منى مهسترة مع مين؟ مع ضعيفة. طب ضعيفة مين هون؟ ampicillin. You took it in biochemistry that AMP, when the cell is low with energy, there is an AMP. So ضعيفة is somehow related to the AMP. So ampicillin. So whenever you hear منى مهسترة, you're gonna remember it بالامتحان مين منى مهسترة؟ ضعيفة. خلوها بالكم. Ampicillin treats Listeria monocytogen and enterococcal. Okay? Good? So let's move on. Now the aminopenicillin, another one is amoxicillin. Now amoxicillin, it's mainly used as an oral drug and this dentist procedures. They represented it where there is a corner in sketchy, and this corner they put ammo. How many of you play PUBG or Fortnite? Yeah. So you know what's an ammo?
Yes, come on.
You had a ammo? It's like,
The bullet.
yeah, the bullet's inside the gun. So they put here an ammo, and they're showing the guy as if he's swallowing one of these bullets, and he's opening his mouth. So it's an oral drug and used in dental procedures. Okay. Now ticarcillin as well. Ticarcillin now, it's Pseudomonas aeruginosa. What was the first one we took? Listeria monocytogen. Don't mix them up. Pseudomonas aeruginosa, in all the sketchy videos, you're gonna see it related to the Mona Lisa. So as you can see here, the Mona Lisa is standing, and there are two guys standing next to her. They're wearing as a tiger outfit, and they're holding a pipe. So let's just remember, Mona Lisa, Pseudomonas aeruginosa, is treated by ticarcillin. Okay? Another one is the pipercillin. Pipercillin, it's very clinically a clinical feature for cleaning the Klebsiella pneumonia. Now, the Klebsiella pneumonia, when you administer pipercillin, you have to administer that aminoglycosides. And with that, also Dr. Prof. Iman mentioned that you can treat the Pseudomonas aeruginosa also with pipercillin. So to memorize that, also Sketchy mentioned that, the Mona Lisa here, the tigers, ticarcillin can treat it, and the piping, they're holding the pipes for pipercillin. Now, we forgot something here. How do you remember that Klebsiella pneumonia is treated by pipercillin? You keep it in your mind, paper and the clips. The paper is for pipercillin, Klebsiella is for the Klebsiella pneumonia. So you're gonna see it in the questions, okay, what do we treat Klebsiella pneumonia? Clips, you remember? Paper, so pipercillin. It's a very high yield slide. And this can summarize up whatever we went through the penicillin families. Now let's see one more thing. In penicillin, we have struggled with one thing, that they cannot be treated, they're broken down by the beta-lactamases, right? So we're still advancing with the technology, and they're like, okay, we'll give another drug that can kill the beta-lactamase, and So penicillin can do whatever their job is. And these drugs are, they are different drugs based on what type of penicillin you're given. So for amoxicillin, it's a clavulanic acid. You administer to the clavulanic to kill the beta-lactamase. So amoxicillin doing its job, and the clavulanic doing its job. What is the job of clavulanic here? Killing beta-lactamase, yes. Tigercillin with the clavulanic, ampicillin with sulbactam. Okay, so now, can you memorize it? Let's see our mnemonic. Killing a tiger by an ammo. Now, the killing the tiger, killing will remind you of killing who are we killing here? Beta-lactamases. And also killing will remind you of clavulanic. Killing the beta-lactamase and clavulanic. Type. With the clavulanic, what do you administer? The tiger. Who's the tiger? Tigercillin. Who's the ammo? Amoxicillin. So whenever you have, what combination can we use? We gotta remember amoxicillin and tigercillin, killing the tiger by an ammo. You cannot follow mnemonics from the first time, but once you revise the size more than once, these mnemonics will be easy to stick in your mind. Now, our friend Mona, معدتها ضعيفة, saluting weak Mona. Saluting will remind you that sulbactam is used with the AMP اللي هي منى اللي ضعيفة. Clear? هلا piperacillin and tazobactam, and I'm leaving it for your imagination. You can invent your own mnemonic. Okay, let's talk now about the pharmacokinetics. Absorption. هلا الحمد لله penicillins, they are widely distributed in the tissues, good absorption لإلهم. And when it comes, we have a misconception is they tell you that ampicillin, you have to eat, like you have to eat your food and then take the ampicillin family or take the antibiotics. So this is wrong because all are impaired with food. We have it in families like, okay, if you're taking an antibiotic, take with it food. But they're all impaired with food. The only exception that we have is amoxicillin. Amoxicillin ما بتفرقهم, does not matter. Is it with food or is it not with food? It's not really affected. Yeah, distribution, we said that it's widely distributed to the tissues, except the CNS. It does not penetrate the blood-brain barrier. However, subhanallah, when there is meningitis, the blood-brain barrier will increase its permeability. Inflammation is going to increase the permeability, so it's going to penetrate and can enter and treat it. But however, again, penicillin مش the first line of treatment for meningitis, and you're going to see with us. Elimination, it's eliminated renally, so you have to bear this in mind whenever you have a patient with renal dysfunction, because you have to administer the dose. Except in the exceptions, you have minafcillin, it's biliary, and amoxicillin and dicloxicillin. Oxacillin and dicloxicillin. So these are minafcillin biliary and oxacillin both. So بيجيكم patients, okay, we want to treat them well, بس penicillin وعنده renal failure. رح تنسوا كل اللي قبل, you're gonna just focus on nafcillin or these two. Okay, let's go with the now adverse reaction. As I mentioned, when these RBCs are broken and the beta-lactam is broken down, it's got stuck to the RBC, رح يصير عندنا hypersensitivity reaction اللي هي anaphylactic. You know all the symptoms of it. Okay, هيك خلصنا البنسلين. This is just a wrap. هاي الانفورميشن ركزنا عليها. It's a highly needed question. This is what mainly you have to know about it. Let's go now with the cell inhibitors.
We're gonna start with the cephalosporins. Again, there's a sketchy page. كمان Shahd noted everything down, but if you want to use it, and we really advise you to start experimenting what suits you. Sketchy might be one of them. Yeah, because not everything is going to be included either ways. For the classifications, basically cephalosporins is divided into generations. And why do you think we keep on adding generations? Exactly, we want to cover more bacteria as much as possible. So to increase my spectrum to cover more negative as long as they are stronger. Starting with the first generation, اللي هن the weakest cephalosporins, صح؟ the first generation, طبعا كل cephalosporins start with Ceph, صح؟ Either with F or PH. After the Ceph, the first generation is always going to have an A after it, مثل alphabetical letters اللي هو A is the first letter, except the cefaclor. دائما second generation حيعمل لنا exceptions. The cefaclor is to the second generation. بس غير هيك كل الأدوية حتى مو بس هدول هلا دكتور إيمان is only enlisting these two. بس بعدين when you get to know the other cephalosporins everything has an A بعدها بيكون going to the first generation. Okay. So بما إنه it's weak ف it's sensitive to beta lactamases بس هاي this is a high yield information إنه بالsurgical procedures we use cefazoline اللي هو first generation as what? A prophylaxis for surgery. يعني أنا to avoid infection from happening I administer this. كمان بالsketch it's موجودة لأنه it has شو? A surgical equipment. For the second generations حكينا هدول كل ال exceptions they're gonna be here. أول وحدة حكينا عنها cefaclor. Cefurexime من the his furious. Okay, furexime. And these cephamycins, these guys emphasize on these لأنه these are very important. Okay. طيب هلا الcefaclor cefurexime اللي هن مانن cephamycins they are working on the negative aerobic while the cephamycins work on the anaerobics and this is very important, keep it in mind. Here حكينا the first and second generation we're not expecting them to cross the blood-brain barrier صح ولا لا؟ There is one exception for the cefurexime. It crosses the blood-brain barrier لأنه you can memorize it as furious mindset. Mind it crosses the blood-brain barrier and furious for cefurexime. It is effective for meningitis. But our first line is going to be the third generation for the blood-brain barrier. The third generation is going to end with I'm that one, okay? So whatever is ending with I'm is to the third generation with again one exception اللي هو cefurexime. الفurexime من الfurious اللي هو وشو كان الاكسبشن الأول اللي حكيناه؟ cefaclor. cefaclor cefurexime كانوا اثنيناتهم second generation. تمام. The third generation أول شيء that needs to pop in your mind هو treating the meningitis. The third generation cephalosporins they target the meningitis as a first line drug. ليش؟ لأنه they cross the blood-brain barrier. فمnemonic for it اللي هو the 3 B's. It crosses the blood-brain barrier. 3 for a third generation. هلا هون ceftazidime حتلاقوني مو حافظة الأسماء يعني أنا دوبني حافظة بس النمونيك تبعه أوكي اللي حافظة بس آخر تاعي. ceftazidime it's used for pseudomonas aeruginosa. The pseudomonas aeruginosa we used to represent it by what? Mona Lisa صح؟ in sketch is gonna كمان be represented by Mona Lisa. فكمان it's gonna be used for it. دائما when we have Mona Lisa رح نحاول نغلي Mona Lisa بشجر. فدائما أي antibiotic we administered with aminoglycosides. Okay? طيب we mentioned قبل شوي for pseudomonas aeruginosa 2 drugs كمان حطينا مع aminoglycoside to treat it. مين كانوا؟ piperacillin tiperacillin اللي هن كانوا بهاي الصورة صح؟ اللي هن كانوا التايجر والباي و they always have the sugar for the Mona Lisa. Okay. The third generation حكينا عن السودومونا أرجمينوزا. حكينا كثير عن المننجايتس إنه هي it's the first line drug. كمان it treats the gonorrhea و it does not treat the meningitis that's caused because of Listeria monocytogenes. For Listeria monocytogenes which drug do we use? Ampicillin. فمعناها a patient that has meningitis فأنت شو حتفكري ببالك؟ third generation cephalosporin. بس the culture turned out to have Listeria monocytogenes. You're gonna subside the third generation cephalosporin. فورا حطي ampicillin. Okay? هدول كمان الميديكيشنز محطوطين بالسكتش. For the fourth line drug, it always have a pi. هلا هون the mnemonics might not make sense لأن the doctor is giving you one example, but definitely they're not only one example in real life. The fourth generation has the pi in it. فهون نفس الشيء كمان لاقيينه. But information they were normal. The fifth generation دائما الفifth should remind you with the MRSA. Okay? هلا هون عندنا أكثر شيء extended spectrum. فهاي السبectrum تبعت السكتشي. Here the fifth generation always has a role in its name. هون صفتها رولين اوكي كمان هون عطتنا one name ف it does not make sense بس it always has a role as if the cephalosporin is rolling the MRSA. هاي إشارة المرسى is rolling the MRSA so it's used to treat the MRSA اوكي. فمثلا كمان السؤال بيسألك إنه what's used to treat MRSA you're gonna think of the fifth generation صح؟ فهلا مبدئيا هذا the first drug إجانا to treat MRSA. We're gonna know about vancomycin بعدين.
I'm not going to explain it, just quickly. One, the first generation, second, third, fourth, and fifth. Just look at the fifth and the fourth. Fifth is very extended spectrum. حاطين عليها the spectrum, it's the rainbow. And this is the MRSA. It's rolling the MRSA as if it's destroying the MRSA. So keep it in mind whenever you have MRSA, you use the fifth generation. Here's the meningitis. They're putting it of a brush on their head. But it's the third generation for the meningitis.
Like هيك how you should focus مثلا third generation you think of to treat meningitis. MRSA you think of vancomycin you're gonna think of the fifth generation. We're gonna explain vancomycin. Fourth ما كان في something very special about it فهيك you actually did use the high yield information mainly for هدول لأنه لسه year ones you're only taking the bacteria واسم الانتيبيوتيك ف it's a bit vague صح؟ Yeah. هلا cephalosporins they are parenteral or they don't cross the placenta. فمثلا اجتك a patient it crosses the placenta. فاجتك patient pregnant for any disease مثلا meningitis not caused by Listeria monocytogenes. Would you think of cephalosporins? Never. فورا بتشيلوها من بين الخيارات. هلا you can memorize it as baby with big head, baby that it crosses the placenta, and the head would always refer to cephalosporin. Big head is an abnormality صح؟ فإنه cephalosporin is tetragenic. You can't use. It's not tetragenic but it crosses the placenta ف it impacts the baby. هلا كلياتهم they are renally excreted مثل مين؟ البنسلين صح؟ مع exceptions اللي كانوا نافسلين واكسسلين دايفلوكساسيلين. The only cephalosporin that's not excreted in renally اللي هو مين؟ ceftriaxone. كان أي generation ceftriaxone? Third generation and it ends with one. Oh, it has a tria. It's excreted in feces. طيب question time. Patient's culture. I deduced بس الأشياء اللي بدنا إياها من السؤال. Patient's culture came out with Pseudomonas aeruginosa, and he goes hemodialysis. What would you give him from these options? هلا Pseudomonas aeruginosa we agree on certain medications إلها مثل مين؟ piperacillin, ticagrelin اللي هي كانت موناليزا. piperacillin, ticagrelin with aminoglycosides. ومين كمان؟ Third generation, okay? Ceftriaxone is going to be used مع aminoglycosides, okay? فمثلا هون بعدين غير لا اصلا we did not agree on the pseudomonas. هون ركزوا انه the patient is going hemodialysis صح ولا لا؟ What does hemodialysis mean? غسيل كلى معناها he has renal impairment صح ولا لا؟ ف here the only exception was ceftriaxone. It's excreted by feces, okay? فمثلا the doctor is not gonna tell you أي واحد is excreted in feces. She's gonna give it to you in a scenario like this. He goes hemodialysis فأنت حتعرف إنه عنده renal impairment. من بيناتهم الوحيد excreted by feces ceftriaxone. Did you get it? Okay. For the adverse effects كمان adverse effects high yield بس مو high yield تحفظي لي fever, toxicity, rash أغلبهم بيعملوا هيك أشياء. For each medication حتلاقوا في adverse effect هيك shining إنه هي بس special لهذا الانتيبيوتيك. هدول بدكم تركزوا عليهم. فمثلا هون for cephalosporins عندي disulfiram like reaction والستيفن جونسون syndrome. الباقيين لو بتشوفون they are generalized صح ولا لا؟ هلا هدول الاثنين دائما you should remember cephalosporin. هلا الجونسون you can remember it as Johnson's for baby's head الهيد اللي هو cephalosporin. فcephalosporin causes Johnson's syndrome. والكحول makes the head heavy أو it's heavy on head. فكمان cephalosporin بيعمل disulfiram-like reaction. Disulfiram, I think Dr. Iman explained this for you, is a patient wants to cut out alcohol consumption. شو ببلشوا يعطوه؟ disulfiram. Disulfiram inhibits aldehyde dehydrogenase. فشو بيعمل؟ acetaldehyde بزيد accumulation بزيد كتير. فالcephalosporin مثل كأنه you're giving disulfiram. فإت's gonna increase the acetaldehyde. وشو بيعمل acetaldehyde accumulation؟ Sorry? Poisoning with throbbing headache اللي هو بيعمل side effects مزعجة.
So you guys got the meaning of Johnson? You know what's Johnson? في مادة الأطفال. It's the same thing. Johnson's for babies. Now we have another cell wall synthesis inhibitor and a monobactam carbapenem. There are different families. Monobactam, and an example for it is aztreonam. Now you can remember it as the ending of it, nam, monobactam and aztreonam. What's special about this family? It can help us by killing the beta-lactamase. So this is one thing that's very good about it. And these, they don't have cross allergenicity with penicillin. In the clinic, you're going to see a lot of patients that they have penicillin allergenicity. These drugs, they're not even related to it. They don't cause this allergenicity. One more thing, Iman, they are aminoglycoside. They can replace it with the third generation cephalosporin. These drugs, to memorize it, still they're single, they're mono, however, they're strong. Okay, so how do you remember that they're strong? Because they only kill the negative. They don't kill the positive. So patient رح يكون عندكم جاي negative, having a negative bacterial infection, but at the same time, he's penicillin resistant. Monobactam will be your first option. Then we have the carbapenem and imipenem, the same thing, they're both ending the same letters, penem. They're used for treating of enterobacter infections, and they are destroyed by the dehydropeptidase in the kidneys, the renal dehydropeptidase. So these drugs are pretty good and they are not affected by the beta-lactamase. However, when they go to the kidney will destroy it quite fast. So they invented something, it's called the cilastatin. They will come to the kidney and tell them stop producing this so the drug can stay for longer, increasing the half-life of it. And you can remember it by car enters back door and stop. The car is the carbapenem, enter back, enterobacter, because you remember we have the enterococci. Here, just enter back, it's for the enterobacter with the car. Who's the car? Carbapenem. The door is the dehydropeptidase. It's gonna enter it and it's gonna be destroying it. However, we tell them stop destroying it by the cilastatin. And you know what the word statin here, what does it mean? Static, stop, exactly. So we're gonna stop it. Stop the enzyme from destroying the drug. And here's the mechanism, like how treatment. Okay, so just cilastatin, how does it affect the... Okay, so this is how it's gonna affect it. They're gonna just stop the mechanism, the dehydropeptidase, so the drug can live happily ever after. Now,
again, this is how the cilastatin should always remind you of the carbapenem, should always remind you of cilastatin, not that.
The car that enters the back door and stop.
اوكي هلا خلصنا من the beta lactam ring. هلا now we're starting with the non beta lactam. We're gonna discuss the vancomycin. Vancomycin كتير lovely. I used to love it صراحة.
The way we memorized it was really helpful. This is a video from Pixarize. It was not covering all of this information. I added them, but I'll go with it with you so you can guys get familiar with it. The vancomycin is going to remind you with the van here standing, and this guy is going out of the car at the van, and he's plugging his ear and he's turning red. Red is going to remind you what the red man syndrome is caused due to toxicity from the vancomycin. You can see that this man is annoyed from the vancomycin. He's turning red man syndrome with the vancomycin. Ototoxicity due to his plugging his ears. And then we can see that this guy, there's jelly beans falling from him. The jelly beans is looking like what? Kidneys. The vancomycin, when it's increasing, like there is a higher dose, it's gonna cause a nephrotoxicity in high doses. And this man is stepping on some, I don't know what is mold, there is something falling in his footsteps. And these are, it's supposed to remind you of diarrhea that's caused by Clostridium difficile. This is very common, and it's only like the first line for treating it is the vancomycin. Clostridium difficile, always think of the molds here, and it's related to vancomycin. And then he's entering a class. This class is called Mrs. A. The teacher of this class is called Mrs. A. The vancomycin treats MRSA. Who's the drug that we took before treats MRSA? Yes, the one who's rolling, the 5th generation, exactly. It's gonna treat MRSA. In this class, they only teach them how to take A+. And A+ should remind you that vancomycin is only treating a gram-positive. And to end it, like they're coming out of a wall, the van is standing next to the wall, someone inhibitor. And penicillins, they used to inhibit what enzyme? Transpeptidase. But vancomycin, yeah, it's different one. It's transglycolase. I added something here that they are stepping on a very ugly pen here, the penicillin. They are against penicillin resistance. Okay, so let's just go through.
Okay. So here, مثل ما حكينا, it's usually for gram-positive, and it treats everything but enterococci. هلا الانتيروكوكاي used to be treated by مين؟ الأمبيسيلين اللي هو it was مادة من الطيف. Yeah. بعدها بس vancomycin is such a great drug. والانتيروكوكاي is not easy to be killed, صح ولا لا؟ the scientists tried to find a way to treat the enterococci with the staph aureus اللي هن some kind of bacteria that they're not easy to be treated, صح ولا لا؟ By a combination اللي هو vancomycin و gentamicin. Keep remembering this the year 2 and you're gonna need it. So Staphylococcus aureus bimicrobiology, Dr. Hiba, what did she say about aureus? What does it mean? Gold color, صح. والenterococci was always represented with us with the stomach, صح? As we can see here, the stomach, it's treated by the combination of those two drugs, the gentamicin and vancomycin. إذن دائما هدول, when are used in combination, they are targeting the staph aureus and the enterococci. There is here a nice mnemonic. The gentleman of the van has a golden stomach. Very nice, huh? Gentleman, gentamicin. Van, vancomycin. Golden for staph aureus, to treat staph aureus. And the stomach for the enterococci. We're gonna use it personally for our exams. Okay. هلا الvancomycin حكينا it works on which enzyme? Transglycolase. It works in the same manner on the same site. شو كان أهم site أصلاً those enzymes؟ the D-alanine اللي هو هون. The D-alanine بتشوفوا الvancomycin, it comes and bind to it. فبصيروا الانزيمز اللي هن transglycolase, when they come they see the vancomycin, they can't complete building the wall, صح ولا لا؟ تمام. هلا تتذكروا لما حكينا الانتيروكوكاي الvancomycin can't treat it الا اذا كانت a combination with which drug؟ gentamicin. طيب شو سبب الريزيستنس هذا للانتيروكوكاي؟ Basically what enterococci does, بتشيل الدي الانين وحده وبتحط بدالها شو؟ دي لاكتيت. فالvancomycin لما بيجي بيشوف دي الانين دي لاكتيت, it's not the binding site that it is used to. ف it subsides. فلهيك we give the vancomycin and the gentamicin together to treat the enterococci. Okay, the vancomycin, remember in that picture that we have the footsteps. So vancomycin treats the Clostridium difficile. Hala, when we go to the pharmacokinetics of vancomycin, how we usually administer it? IV, okay? Yeah, parenterally with IV. Hala, the V in vancomycin can remind you with IV, because I don't know to what extent it's beneficial. Let's we give it IV. Poor oral absorption. طيب, think of it. in your stomach C difficile, where is it going to be بالintestines. اللي هو الجي اي تي تراكت بشكل عام جي اي تراكت. طيب هلا الكلوستريديوم ديفيسيل حتكون هنيك. I wanna give vancomycin to kill it. I gave it IV. ممكن تساعد بس how can I give it in a way تضل موجودة بالجي اي تي وتقتل الكلوستريديوم ديفيسيل orally. ف this is the only case we give vancomycin orally لأنه it's poorly absorbed ف it's gonna stay for a long time in the GIT working on killing the Clostridium difficile. Did you get this point? This is very important. Lastly, تتذكروا لما حكينا المننجايتس can be treated by whom? Third generation. تمام هون بيحكوا لك كمان they can use it as a combination with ceftriaxone أو cefotaxime اللي هن both of them are third generation with the vancomycin for treating meningitis. Here like this is the triaxone zone picture from Sketchy and this is Evan. Meningitis should always remind you of those two drugs. Regarding the side effects, we mentioned them in the picture already. The ototoxicity, the nephrotoxicity, and the red man syndrome. مثلا طلع على باقي adverse effects, phlebitis, chills, fever. Are they high yield? طبعا لا, they are very generalized. فالvancomycin should always remind you of those three adverse effects, okay? تمام, question times.
Okay, so now guys, we wrapped quickly through the lecture. It's just mainly for you guys how to understand how to tackle pharma and how to memorize it. Let's just get to examine ourselves and see how we can answer the questions. Give you 1 minute, just go through the questions and read the options. Keyword, صح؟ Clostridium difficile. طيب هلا the question it's not asking you to give me the drug. ما بدهم the drug. They're telling you what characteristic we want to treat Clostridium difficile. C? All agree on C? You sure it's not D? في حدا اختار D؟ ما حدا اختار D؟ انت اختار D؟
C low oral bioavailability. It's all oral bioavailability. Like extended release.
هلا استنى let's discuss دي. Clostridium difficile يمكن it's a gram positive. I'm not sure if you take it بالmicrobiology, but it's a gram we will take it. فإنه it's not gram negative. ففور you're gonna omit the option. Bilateral elimination احنا حكينا it's not CNS penetration. ما جبنا أصلا سيرة الvancomycin بالCNS. Lastly is he is susceptible to beta lactamase. حكينا الvancomycin لأنه it's not related to the question here. Let's come to the lower oral bioavailability. حكينا إنه vancomycin V ما سمعت IV yes exactly so V it's IV ليش؟ لأنها if you give it orally it's not being distributed to the tissues. So what we do here إحنا it's a special case for Clostridium difficile. This bacteria is in the intestine. So إحنا we want it أصلا not to get distributed to all other tissues بس بدنا إياها تضلها بالintestine وال GIT tract. But this is why the main characteristic of vancomycin as an oral drug efficient in treating Clostridium difficile. Got that? في حدا ما فهم البوينت؟
Is the pneumonia part also related to
I'm not sure صراحة بس هلا هم البريكوشن they can give you other symptoms like بس they're telling you خلاص this is the main okay? We all got the question? Yeah. Let's go for the next one.
So basically this is how you're gonna get the question. A case, she might not ask you about the drug. You should know the drug وتعرفوا شو adverse effect مثلا أو some pharmacokinetic information. طيب let's see this question. I'll give you command 2 minutes. What's your answer? Okay. Do you want to explain it or مثلا interpret? They can hear you?
Can you hear me? Yes. So basically, cefoxitin is one of the cefamycin. So cefamycin, we said targets anaerobic bacteria. And
Yeah. So basically صح. هون كل السؤال زيادة. You're targeting anaerobic. We have cephalosporins everywhere. This one, which generation? Cephaclo, exactly. This was the only exception with the A. Sulfuric sign. Furious. No, furious. It was the only exception of the I. Because it's a furious, it's in the second. The cefoxitin, it's a cefamycin اللي هو second generation. Cephalexin. Yeah, sure? Yes, first generation. فكرت third. Okay. فمثل ما what's your name؟ عمر. مثل ما عمر said anaerobic فورا لازم تتذكروا مين من بين cephalosporin cephomycins. شو هن الثري cephomycins؟ cefoxitin cefotetan metazole. أيوة cefametazole. So these three, which one is available? The cefoxitin. Good job عمر. Did you get this question? Okay. كمان here I'm gonna give you 2 minutes. So what do you think, which answer? B. صح؟ ليش? Can someone explain? Third generation. What's the meningitis? Here they did not mention which bacteria. For meningitis, you're gonna think of the third generation. Why? Because it crosses the blood-brain barrier, the 3Ds. مثلا, if it was meningitis, but because of Listeria monocytogenes, ampicillin. So this is how you should actually get the high yield information, link them together, okay? It's not going to be straightforward, it's going to be a little bit twisted, but if you basically get the main points, مثلا طرق meningitis third generation, MRSA for what? How do we treat it? Fifth generation cephalosporins and vancomycin. This is very important. The combinations to treat the Pseudomonas aeruginosa, what are they? With aminoglycosides, صح؟ تمام. So basically that's it. Our last advice. Using the high yield information مثل ما we did. نحن here we are not coming aiming to explain because it's pretty simple. Dr. Iman tried to enlist it in a very simple way through her slides. بس what does not make sense and you're only memorizing some names with antibiotics. That's why it seems overwhelming. Solve questions to familiarize yourself with it, and no, it's not going to be a straightforward question. Try Anki. It's your time to experiment now. For me, I don't use Anki a lot, but for these, I used to try them once for each lecture, صح? It was a bit helpful, but I don't do Anki صراحة regularly.
mnemonics. يعني I tried my best صراحة يعني to include as much mnemonics as we can, بس despite يمكن انتم تشوفوا حالكم not remembering it once in the exam هيك فلاش لايت ساعة وانتم صافيين بالكويشن حتتذكروا mnemonics اخترع بالكم. repetition هلا from the first exposure to the lecture, second exposure يمكن at least 50% of the slides will get stuck in your mind, but more will be while repeating this third time, fourth time, fifth time. And lastly, attending lectures. Try to attend lecture. You get at least familiar with whatever the doctor wants, what she's focusing on. Aside from pharma, your other lectures, the doctor focuses a lot on specific points, and this is what they focus on as well in the exam. يعني try your best to attend the lectures. And that's it يعني. إن شاء الله إحنا عملنا هون يعني صراحة we have been spending a lot of time على preparing these slides and mnemonics. But for the sake of helping you, قد ما we struggled فيها last year. فإن شاء الله نكون ساعدناكم يعني at the end أتمنى نكون أنا وصلت المعلومة واحد من دعوتكم. Any question? Yes, sure. Thank you so much.